Good morning to you all, and Happy New Year. I'm Renee Francoeur with Cabinet Communications and the moderator for today's COVID-19 update. We are joined today by Premier Sandy Silver and the Acting Chief Medical Officer of Health, Dr. Catherine Elliott. Thank you to Mary Thiessen for joining us on Zoom and providing our ASL interpretation, and to André Boussier for providing our French translation. Following the remarks from our speakers, we will go to the media present in the room and then on the phone lines for a round of questions. I'll call you by name, and you'll each have 2 questions. We will also circle back at the end for another round of questions. Before we begin with our speakers, I would like to verify that everyone can hear us. If any of the reporters are having problems, please email ecoinfo@yukon.ca. I will now hand it over to Premier Silver.
Thanks very much, Renee. And thanks everybody for joining us here. We're coming live from the traditional territory of the Kwanlin Dun First Nation and the Ta'an Quechan Council. It's really good to be here with Dr. Elliott and the whole team. I hope that you all had some rest and some downtime over the holidays, at least when you're not shoveling or trying to keep warm here. Obviously, the situation has been very dynamic over the last 2 weeks and even over the last few days as well. The Omicron variant continues to spread at alarming rates across the country, and we are now seeing an increased spread here in the territory. I know this disrupted an awful lot of holiday plans, and things had to be scaled down. I've said it before, you may be done with the pandemic, but certainly the pandemic is not finished with us yet, and it does remain a very serious situation. We have lost another Yukoner to COVID. This is the 15th death since the pandemic began. I offer my sincere condolences to the family of this individual. Our thoughts and prayers are with them and their friends and their loved ones at this time. We have been through an awful lot over the last 2 years, and we need to keep going. Yesterday marks the 1-year anniversary since the first doses of COVID-19 vaccine were administered here in Whitehorse at Whistle Bend Place. Since that time, we have rolled out vaccines for all Yukoners over the age of 5. It was a busy year. By the end of 2021, nearly 90% of Yukoners age 5 and up have received 1 shot, and 80% have received 2 shots. I want to thank all of the immunization teams that have helped us get to where we are right now with our huge success in vaccination rates. Every shot delivered helps keep our territory safe. We are now into the booster shots. We began rolling these out to the most vulnerable Yukoners in September, and also then after that to our long-term care residents and those over 50 years of age. The boosters are now available for those 18 and over who received their second shot more than 2 months ago. I'm very happy to see so many folks eager to book their boosters, and I thank everyone for their patience as well. Additional clinic appointment times have been made available, and we have increased access to the clinic here in Whitehorse as well. Starting this week, the clinic is now open Monday through Saturday. This is so that we can help get more Yukoners vaccinated and boosted, which is absolutely our priority right now. Again, you can book your appointment time online. Just go to the website, yukon.ca/this is our shot. Booking an appointment is always recommended, but walk-ins will be accommodated as much as possible. And I want to thank the folks that are working at the clinic. I know several people who have received their booster shot, and I received mine just yesterday, and I tell you, the clinic is very, very well organized, and it is operating smoothly and quickly and very, very professionally. The folks at the community health centers, they're also doing a fantastic job as well. So thank you very, very much to everybody helping to inoculate Yukoners. The vaccine remains our best form of protection against COVID-19, but as we know, they're not enough to address the new Omicron variant. It's spreading like wildfire. So being vaccinated is the best tool against Omicron. Last Friday, we announced additional temporary public health measures as well, based on new recommendations from Dr. Elliott and her team. Those include limits on indoor and outdoor personal gatherings, limits on organized gatherings, and restrictions on restaurants and bars, as well as recreation and leisure sites, such as gyms. Now, you can find all the information you need about the new public measures. It's all available online at yukon.ca. These measures are being introduced to reduce the risk of transmission of COVID-19 and limit impact on our territory's healthcare system. We are strongly encouraging all Yukoners to follow these new measures immediately. They will be enforced under the Civil Emergency Measure Act starting Friday, January the 7th. Now, we recognize that these measures are not welcome news for everyone, especially as we start a new year. If you asked me a year ago if we were going to be in this situation as of now, I would have been surprised. But the variant and the virus continues to surprise. But we are still here. We're still here to support you. In the initial phase of the pandemic, the government of Yukon took early action to provide financial support to Yukon businesses and employees, and we have continued to adapt as we navigate through this pandemic. Since we declared a state of emergency in November, we launched the Yukon Emergency Relief Program, and this program focuses in on funding eligible fixed costs for Yukon businesses and non-recoverable financial commitments for events that were canceled or significantly altered because of new orders under CEMA, the Civil Emergency Measure Act. It has one stream for businesses. It also has another stream for NGOs. Yukon businesses and organizations can contact the Department of Economic Development to start an application by emailing them at ecdev, and that's at yukon.ca. So ecdev, ecdev, at yukon.ca, or also by phoning 867-456-3803. Additionally, the paid sick leave rebate is still available for folks that need to miss work due to COVID. It provides up to 10 days wages for workers who are sick, self-isolating, or caring for others, other household members due to COVID-19. All eligible Yukon employers and self-employed individuals may apply. Now, this rebate program has supported hundreds of employers in the territory, and it's still available, even if you've accessed it earlier in the pandemic. Our COVID-19 support programs, they are the gold standard across Canada, and we will continue to provide them for as long as needed. Now, I want to thank all of the businesses and organizations that continue to adapt to ensure that their employees and those who they serve remain safe and protected. These continue to be extremely challenging times. With the new Omicron variant spreading quickly in the territory, we need to take action to protect the health and safety of Yukoners and ensure that our healthcare system is not overwhelmed. These new temporary public health measures are intended to limit the number of contacts between individuals and ultimately reduce transmission. We all have a role to play in keeping the territory safe, and we all need to take precautions to prevent COVID-19 from spreading in our communities. This includes practicing the Safe Six, masking up, and getting vaccinated. This is a new variant, but we already know the fundamentals of how to prevent it from spreading. This includes in our school systems as well. I know that many parents are anxious about students returning to the classroom as we see some spikes in cases. Dr. Elliott and her team have been working extremely close with the Department of Education over the last several months. This is not the first school year that the pandemic hit us in, and we've learned a lot over the years. All schools have operational plans in place to keep students and staff healthy and safe. These are developed based upon guidance from Dr. Elliott's office. When we declared the state of emergency last November, we strengthened public health measures in our schools. This includes requiring students to wear masks at all times when inside the schools. Dr. Elliott continues to recommend that schools remain open for in-person learning, and it is our priority to keep students in the classroom. Students should be the last schools should be the last thing to close down in a pandemic. We know that keeping schools open and available to students is good for their well-being. Social interaction is important, especially as we work to minimize the social activities that are going on outside of schools to limit the spread of COVID-19. I want to give a big shout out to all of the educators and all of the staff that have worked extremely hard in the schools, with the school community, to keep our schools running and to support our students and to keep them learning through these very, very trying times. This is such important work, and as a former educator myself, I know how challenging it can be and how committed our teachers are to supporting their students. So again, thank you very much. We will continue to monitor the situation and adapt as necessary based upon the best public health advice available. Thank you very much, folks, and with that, I'll turn it over to Dr. Elliott.
Thank you, Premier Silver. And good morning, everyone. Bonjour. Happy New Year to everyone. And I hope you enjoyed a safe and happy holiday, even though it may not have turned out as you planned. Once again, COVID-19 is at the forefront of many people's minds. There are many other important things in life, and I hope that we are able to move away from this focus soon. As we begin 2022, we're entering a new phase of the COVID-19 pandemic. We're in another wave of Omicron, and we're in another wave with Omicron variant, and this means that we need to adapt. Omicron is like a blizzard that's blown in. It's causing disruptions to many lives and facing many of us to respond. Even though many of us wish it were over. I was driving down here today and doing my usual effort of not speeding, which is high effort for me, and realized how cold it was and hoped my car would do okay. Suddenly, I realized I was in ice fog and going a little too fast. So I slowed down, made sure my lights were on, and adapted. And just like that, it's time to go slow, to be wise, and to adapt. In the short term, this may be challenging. It already is for many people in Yukon, and it will continue to be in the coming weeks. I'm so glad that so many people in Yukon are vaccinated, because vaccine protects people. So fewer will have severe disease requiring hospitalization, and fewer will die. Over the long term, this actually is a step forward toward living with a milder form of COVID-19. And over the long term, this means we can focus our efforts on those who most need them. Here's what's happening with COVID-19 around the territory today. 2 people are in hospital with COVID-19. The average new daily case count is 50 over the past 7 days, and 63 over the past 3 days. So 50 over the past 7-day average and 63 over the past 3 days. Tells you the case count is rising. There are 302 active cases in the territory. These are unprecedented numbers for us. Over the course of the pandemic, there have been a total of 2,010 Yukon cases, and 1,704 of those have recovered. 15 Yukoners have died. I send my heartfelt condolences to the family and to all who have lost loved ones, whatever the cause. We are seeing a rise in case counts, and cases have been diagnosed in many territories throughout the many communities throughout the territory. We also know that there are many more cases that have not been diagnosed. So our case counts reflect a portion of the true number of cases in Yukon. This means that there is widespread community transmission and potential for exposure in most settings and most communities. And people would be wise to use their COVID sense throughout the territory. We have already seen the epidemiologic signature of Omicron, the rapid case rise over a very short period. Omicron is highly transmissible. It spreads wider and faster than Delta. It can affect all people, even those who are vaccinated, but it tends to cause severe disease in those who are not yet fully vaccinated, those who are older, and those with chronic disease. In Yukon, it's following the pattern we have seen in other parts of Canada. In the short term, the number of people who could be infected with Omicron means that a large number of people could require hospitalization at the same time. We are starting to see this in other parts of Canada. In Yukon, we're not there. And now is the time to prevent this. We now need to pull together and do what it will take to keep severe cases as low as possible. It's time to get our boosters so we don't have severe disease. It's time to reduce our number of contacts, to follow the Safe 6, to wear our masks, and follow all the measures. Without these measures, our health system will very likely be overwhelmed. Even with them, we will see a large number of people infected, but fewer than without. I'd like to emphasize why we're seeing this even though so many of us are fully vaccinated. Vaccination works a little differently with Omicron. With Omicron, vaccine reduces the likelihood of infection, but not as well as with Delta. Therefore, people who are partially or even fully vaccinated are being infected. Adults, as their turn comes, are eligible for their primary series of 2 doses, 8 weeks apart, and a booster 6 months later. When they have received all of these doses, they have the strongest immunity possible. Over a third of Yukoners have now had their boosters. Over a third of adult Yukoners have now had their boosters, and many more are on the path to becoming fully vaccinated with that strong immunity. What does that mean for you? Well, it means an awful lot of people have gotten vaccinated, which helps you be protected. It also means it's time to check your vaccine status and get your dose when your turn comes. Because when you are fully vaccinated, you are less likely to become infected. When you are fully vaccinated, you are less likely to infect your contacts. When you are fully vaccinated, you are less likely to be hospitalized, to need oxygen or breathing support, or even to die. This is why vaccine is so important now. And I just want to give a shout out to the team that's working to help people get vaccinated around the territory, the healthcare professionals, the IT support, the people who clean the vaccine centers, the people who drive people to get vaccines, the people who have those tough conversations where maybe they don't agree with the person they're having a conversation with, but they know how to listen, be kind, and meet people where they're at. Thank you. If you've had COVID-19, it's still important to get vaccinated. Vaccine and past infection work together to train the immune system, so it knows what to do when you become infected. Most of us will be infected at one point or another, so vaccine is so very important now. Yukoners are seeing this firsthand, whether infected themselves or for the first time knowing someone close to them who has been infected. We are seeing mild illness among those who are fully vaccinated, and each vaccine contributes to this. That demonstrates how effective vaccine is, and it shows how getting fully vaccinated and getting your booster is still absolutely critical, more than ever. But it can't be the only action that you take. Our intensive care system in Yukon is very limited. There's 4 ICU beds in Whitehorse, and these are the only beds in the territory, so we don't have a lot of surge capacity. We need to follow these measures so that the hospital is able to treat all of the patients who need care, whether that's for COVID-19, for another illness, an injury, or something else. The hospital is doing well so far, and if you have any illness, please don't hesitate to go to the hospital for care. It really won't take much, however, to overburden the system. It's essential, therefore, even if you're vaccinated, even if you have your booster, that you continue to layer on the other protections. Keep your distance physically, but stay in touch emotionally. Clean your hands. Stay home if you feel sick, even with the mildest of symptoms. Avoid any crowded places. Avoid any non-essential travel. Self-isolate when it's necessary. Wear your mask. Limit your contacts as much as possible. One key tool we have now, and that is still serving us well, is isolation. It's only by constantly combining all of these protections, especially limiting our contacts as much as possible, that we'll control the spread of Omicron and stay healthy. You see, controlling Omicron is important now, not only for the health and wellness of individual Yukoners, but also for our healthcare system and for our communities as a whole. If too many of us get so ill that we require medical care, there's a very real risk that will overwhelm the healthcare system. There's a very real risk of other essential services being shut down and businesses being closed. We are seeing this happen in other jurisdictions where they're being forced to take even more stringent measures. We need to work together to prevent that happening here in Yukon. Already in Yukon, the numbers we're seeing are high enough that there's a very real risk of services being affected. We only have 4 ICU beds. So even if you don't get vaccinated for yourself, and even if you don't follow the measures for yourself, even if you hate wearing a mask, do it. Do it for your family. Do it for your friends. Do it for those seniors and those elders, those traditional knowledge holders. Do it for our vulnerable populations. Do it for the doctors, nurses, and other frontline workers, who many of whom are very close to burnout, and that is real. Do it for the people working at the businesses and in public spaces. Do it for the Yukon. It's important to recognize that each of us is part of this community, and each of us has an essential responsibility to play in maintaining the health of our community. Only if we get the spread of Omicron under control and keep ourselves healthy and our healthcare system stable will we find ourselves in a position to roll back the new measures that I'm going to discuss today. That's why we all need to start following these new measures that I recommended to government. We need to start following them now. And the government has put these in place in law. I'll describe these in details now. Yukon remains in a state of emergency. We already have public health measures in place, and these new measures build upon those. These new measures were announced last Friday, and they'll become enforceable on January 7th. There are new restrictions on indoor personal gatherings. For households where everyone is fully vaccinated, you can gather with another household where everyone is fully vaccinated. Fully vaccinated means that in this case, and for these statements, it means 2 doses, except for children who are between 12 years and 4 months and 17 years, for whom it means at this point 1 dose. So 2 households can gather together. Maybe they have a 6-year-old in one of those households. That 6-year-old is not counted amongst those people who need to be fully vaccinated. So if 2 households gather together, it's a maximum of 10 individuals. So if there's 9 people in your household, you can have 1 person over from another household, a maximum of 10. It's capped. If anyone attending does not have all the vaccinations they're eligible for, they don't have those 2 doses, or 1 dose for youth, then gatherings are restricted to a single household only. Households with a single person who's not vaccinated may gather with 1 other household. This is so no one is alone. There's a new restriction on outdoor gatherings. personal gatherings. Up to 25 people from a maximum of 3 households may gather, regardless of their vaccination status. There are new restrictions on organized gatherings. Proof of vaccination is required at all indoor and outdoor organized gatherings, except for those children who are under 12 years and 4 months. Indoor organized gatherings are limited to 25 people or 50% of venue capacity, whichever is less. Outdoor organized gatherings are limited to 50 people. At both indoor and outdoor organized gatherings, physical distancing between households is strongly recommended. There are new restrictions on the following eating and drinking establishments and casinos. This includes restaurants, bars, nightclubs, tasting rooms with seating, distilleries and breweries, and casinos. This includes indoor areas, outdoor areas, including outdoor patios of food establishments, at which individuals may sit and drink, including quick service restaurants and cafes. At all of these establishments, proof of vaccination is required for table service, except for children under 12 years and 4 months old. Anyone can still pick up takeout food as long as the business allows it. No more than 6 people may sit at a table, and patrons seated at different tables must be separated by a distance of at least 2 meters. No bar or countertop seating or service is permitted. Patrons must remain seated except to use the washroom facilities and may not move between tables. Dancing is not permitted. It goes without saying that it's also enforceable that we need to wear our masks in indoor spaces when we're not eating or drinking. There are new restrictions on entertainment and cultural venues. This includes movie theaters, museums, another type of theater or cultural space, which would include spaces where an indoor concert or dance or theater rehearsal or performance is held, places where indoor singing or wind instrument practice or performance is held, places where an indoor organized recreational activity or class for individuals is held. At all of these places, proof of vaccination is required, except for children under 12 years and 4 months. A maximum of 25 people or 50% venue capacity may attend the place, whichever is less. There are new restrictions on sports and physical recreation places. This includes gyms, fitness studios or facilities, including but not limited to those where indoor exercise or fitness activities held by a business or organization are held. Dance studios, recreation facilities for active recreational activities, including, without limitation, Canada Game Centre, all arenas, indoor and outdoor pools, including hot pools, recreation centres, community centres, ski chalets, places with climbing facilities, escape room facilities, laser tag facilities, arcades. At all of these places, proof of vaccination is required except for children under 12 years and 4 months. A maximum of 25 people or 50% venue capacity may attend the place, whichever is less. To be clear, the limit is for each space in a facility where the activity is being held. For example, at the Canada Game Centre, there are multiple areas of activity: large gyms, ice rinks, the field house, a multi-purpose room, among others. Boy, are we lucky to have that place. And each of those areas is individually governed by a new limit of 50% capacity or 25 people, whichever is less. There are also new restrictions on recreational team sports. This includes places where an indoor sporting event is held, regardless of whether a ticket is required to enter and regardless of whether spectators are in attendance. At these places, proof of vaccination is required, except for children under 14 years and 4 months. A maximum of 25 people or 50% venue capacity may attend the place, whichever is less. In addition, for sports, arts, and recreational activities, teams or groups may not be larger than 25. While practices are allowed among teams, there can be no mixing of players between teams and no team play. Travel between communities should be for essential purposes only. There are new restrictions on businesses, retail stores, public libraries, and places that provide services to the public. This includes movie theaters, stores, including but not limited to grocery stores, clothing stores, retail stores, liquor stores, cannabis stores, and pharmacies, banks and credit unions. Excuse me a minute. Right. Banks and credit unions, cafeterias and workplaces of post-secondary institutions, public libraries, any space in a government office where a service is provided to the public. All of these places must limit attendance to a maximum of 50% capacity. In addition, at movie theaters, proof of vaccination is required, except for children under 12 years and 4 months. Public saunas and steam baths are not permitted to operate, and all businesses are strongly recommended to have operational plans in place to show how they will go about limiting close contact between people and keeping their employees and customers safe. There are new restrictions on personal services. Proof of vaccination is now required, except for children under 12 years and 4 months. A maximum of 25 people or 50% venue capacity may attend the place, whichever is less. There are new restrictions on places that provide faith-based services. Proof of vaccination is required, except for children under 12 years and 4 months. A maximum of 25 people or 50% venue capacity may attend the place, whichever is less. Mandatory masking continues to be in effect in all indoor public settings and outdoor public settings where physical distancing cannot be maintained. I strongly recommend that people start taking these actions now, if you haven't already. And I thank everybody who's already put these things in place for their community, for their business, for their organization, for their team, for their school, and many other places. These will become law on January 7th. They will be enforced under the Civil Emergency Measures Act, or CEMA. You know, we're going to have to learn to live with COVID-19. And sometimes we have to use these legal tools to mandate things. But we're all going to have to learn to follow these rules because they're the right thing to do. Over the long run, I'm hoping that we won't need to legislate so many things and that we'll move into a space where we all just know what to do. We're not there yet, so we're using the tools we need to use. Well, there's many people who want to know what to expect in the days and weeks to come. In the short term, we will all work to prevent transmission. We will have measures in place and we'll need to ensure we become vaccinated, and in the meantime, we slow down. We keep our contacts low and we use our COVID sense. Many people will become infected and many people will be off work, more than we've had in previous waves. This could be hard on the healthcare system for staffing. It could be hard on staffing essential services, schools, businesses, organizations, etc. Therefore, we will all also need to prepare throughout our lives by having contingency plans for when things don't go how we normally expect them to. When fewer people are in the workplace or there's a shift in schools or in childcare. It's a good time for us to ensure that we have what we need and plans in place should we need to isolate. It's also a time to help others. It's easy to see that everyone right now could just use a little help. and a little extra kindness will go a long way. What we have already done is helping us all, and it matters so much to have done so much already. We've gotten our shots. We've experienced in running businesses and schools and households in these new circumstances. We've developed operational plans, and along the way, we've learned an awful lot of COVID sense. We understand now how to run these organizations, businesses, and essential services in all parts of our lives with COVID. This is all so important now and has trained us for what we are facing. I'd like to talk a little bit about schools. Schools open on schedule this week because they were ready to be safe and healthy learning environments for students and staff. I know many of you have questions about the rationale for reopening here in the Yukon, while other jurisdictions across Canada have delayed the school reopening. Many other jurisdictions are taking an additional week or even more to prepare their operational plans and put measures in place in order to be safe places to welcome students back to the school environment. Our schools in Yukon are already well positioned with established operational plans to control the spread of the Omicron variant. School administrators, teachers, parents, and students are aware of the actions to take in school and what to do in the case of illness. Many of them worked over the holidays to do so. In school, there are established distancing and masking rules and many practices. If students, teachers, or administrators have symptoms, they know that they must stay home and self-isolate until they no longer have any symptoms. It's essential that our children attend school facilities and socialize with their peers. It's important for their education to be in person. It's important for their mental health and their social development. I'm extremely confident that the correct action is to open schools and open as scheduled for students to attend. I will continue to monitor the situation and provide advice to the Department of Education and school officials as we move forward. We're in regular contact. We are watching this situation. If the department needs to move to online learning due to operational matters, such as, for example, shortages of staff or other reasons, they will do so. They have done so. If I need to, I'll recommend a shift to control COVID, but that's not what is needed now. Each of us is playing our part by keeping anyone, even with the slightest symptoms, out of schools, staying home, isolating when we need to, and being patient as things change. I'm going to move to remind you of two other recommendations that we've made recently. First, keep your contacts to a very few people. Let me explain this one. Take a moment right now to think about what would happen if and when you become infected. If you developed a cough right now, how many contacts would you have in the past 2 days? How many people would have been within 6 feet of you for a total of 15 minutes in any day, either yesterday or the day before? Last night, yesterday morning, yesterday afternoon, the day before? This is the part that you can control. Keep it low. Keep things running smoothly. Help people not have to stay home because they've been exposed. And prevent healthcare overwhelm. Even if your contacts aren't likely to require hospital care, a transmission to them could be the start of a chain of transmission that leads to someone who is. Last week, I was very pleased to lighten the burden on people who are contacts of a case. If you are a contact and you have had 2 weeks since your booster shot, then you need to self-monitor for 14 days. You'll note I didn't say self-isolate. You might be wondering about that. Here's what self-monitor means. It means if you have any symptom, even the tiniest sore throat or sniffle, stay home and away from others. It may well be COVID. It's not the time to go and eat at a restaurant with a bunch of people in different households. Wear your mask when you're out and about and keep it on. You can't do that when you're eating. It's a time to lay low, go about the things you need to do, and be even better than ever at practicing the measures. If you're a contact and you've had 2 shots, and it has been between 2 weeks and 6 months since your second shot, then you can self-monitor for 14 days. If you are a contact and you are not in one of those categories above, then please isolate for 7 days and self-monitor for 7 more days. It would be very wise when you're self-monitoring to stay away from those who are at risk of severe disease. People become infectious before their symptoms start. So that's why we have all these measures and why we need to keep people safe who are at risk of severe disease. This includes anyone of whatever age with a chronic condition. You can find this information at yukon.ca, what to do if I'm a contact of a case. Following the period of isolation, if no symptoms are present, close contacts can move to self-monitoring. If you are a contact and you develop symptoms, then you should check online. There you will find information about whether you need a test and what to do next. Here's part 2. I am pleased today that we will be able to lighten the burden on cases. Today, we will shorten the isolation for cases who already have strong immunity. Here's what cases need to do. If you are a case and you are 2 weeks since your booster shot, then isolate for 7 days. And if all of the following conditions are true, then you can come off isolation. 7 days have passed, you feel better, and you're off any fever medicines like Tylenol or Advil or ibuprofen and still don't have a fever. If you are a case and you've had 2 shots and it's between 2 weeks and 6 months since your second shot, then isolate until all of the following are true. 7 days have passed and you feel better and you are off fever medicines like Tylenol, Advil, or ibuprofen, and you still don't have a fever. If you are a case and you are not in the categories above, then isolate for 10 days and you feel better and you are off fever medicines and don't have a fever. Note, this information will be posted online soon at yukon.ca, what to do if I am a case. This starts today for any new cases. Older cases should follow the advice of YCDC, their nurse managing their case, or the instructions they've seen online. We have reduced the burden of isolation as the science currently supports it. We know many people who have taken on isolation. We know people who have isolated themselves or even their children or their families, sometimes even when these close household contacts are not sick, and they've done this to keep us all safe. Thank you so much. I know it's a challenge. You're partners in our fight against COVID, and this is what we all need to do. This is so important now to stop the chains of transmission. Part 3. Now, I mentioned we'd be shifting our focus to those who are most at risk of severe disease, and there's more to be said on this. Let's talk about testing. With community transmission of Omicron and exposures possible in many places, we're at the point that you can safely assume that you have COVID if you have symptoms, and most people won't need a test. Now, I know it might sound strange coming from a person who's been telling everyone to get tested, so let me explain. Omicron is the beginning of a new phase in the pandemic, and we are shifting our management to be in line with the characteristics of this disease. When a disease is mild in most people and highly transmissible, it results in many cases in the population. People with strong immunity don't need a test. They just need to slow down, stay home, and take care of themselves for 7 days. They don't need to get tested. How will you know if you have COVID then? The answer is you will know by your symptoms. Very soon we will have information online that will tell you specifically how to sort this through, and I urge you to check that before you seek testing. We know, we've all heard, that many jurisdictions have gone this way because their testing systems have been overwhelmed. We expect our testing system to become overwhelmed here too. And it's getting there. People right now may not be able to book a test as quickly as they would like to. You see, tests are most important for those people who are at risk of severe disease. They need to know whether their chest heaviness is COVID or something else that requires a medical assessment. Some work in a place where they may expose a vulnerable person, such as long-term care. They need to test to make sure that the right things are done to protect their patients. This is what we need to do in order to protect those who are most vulnerable. The list of those who should get tested will be found on yukon.ca soon. Most people, healthy adults and youth with strong immune systems that have been trained by vaccines, do not require testing. Keeping away from others by isolating for 7 days and taking care of yourself is all that it takes to recover, limit the spread, and protect our healthcare system, and keep those tests available for those who need them. It's very important to protect these systems and limit the spread right now. Still, I understand many people still want to test. They want to know. So we are working hard on developing access to rapid home testing kits for those who want them. The government has just under 5,000 self-administered rapid antigen tests remaining from the initial shipment from the federal government. These have been and are being used to limit spread and outbreaks in settings where there's high risk of spread. We're actively working with the federal government to increase our supply of rapid antigen tests, to have that supply for those who have symptoms, don't really need a test but want to get tested. More information will be released in the coming days on how to access these test kits. If you're using a rapid antigen test and you've been exposed or you have symptoms, I want you to know this. If you get a positive test result, it means you have COVID. If you get a negative or indeterminate test result, it means you might have COVID, you might not. It doesn't shorten your isolation. It doesn't mean you can break the rules and gather with large numbers of people. It just means you might not have it. It doesn't confirm that you have it. So, here we are, together in another phase of this pandemic. It has taught us a lot. It has pushed many of us to work harder, to grow, and to do the things that we didn't think were possible. Many of us have suffered losses. For some, this pandemic has taken away something, a business, a source of income, other things, or someone, before we were ready. For many of us, it has shown us what is most valuable: helping each other, showing kindness, finding new ways to work together, rediscovering the joy in nature, in loved ones, and in time to ourselves. This may well be challenging in the short term. I think that's easy to see. I hope you can see also that in the long term, this is the next step forward in living with COVID-19. Right now, we need to follow the rules, keep our contacts down, be flexible, patient, and kind as things change, get vaccinated, and use our COVID sense. Soon, we'll be past this wave. The measures will lift, and we will have developed and learned even more common sense along the way. The challenge right now is to keep the cases down, to avoid hospital strain, and also for those with strong immunity to learn to manage this mild illness by using the guidance and tools we have at hand. It will need us all to shift our thinking, to be flexible. It will require us all to be kind and patient, even when we don't feel like it. But the days are getting longer, and this storm will run its course, and we will get through this together. Thank you for listening today. Shoni Tan, Gunalshish, Masicho, thank you, and merci. I'm happy to take questions.
Thank you, Dr. Elliott, and thank you, Premier Silver. We'll now move on to the question and answer session with media. A reminder to reporters, please identify which speaker you would like to answer your question before you start. And please also remember to mute and unmute yourself accordingly. I understand we do have one line open creating an echo, so if you could mute yourself now, that would be great. Thank you. We have no reporters in the room, so we will go to the phone lines, and we will start with John at CKRW.
Hi. My question is either for the Premier or for Dr. Elliott, whoever's best to speak on it. Canada just announced that they're sending 140 million rapid tests to the provinces and territories. I'm curious to know how many the Yukon is getting, or if we're getting any, seeing as we're not distributing them as widely as other jurisdictions around the country are.
Yeah, I would say that we're getting our fair share. More details on what we're getting will come out of Health and Social Services, but these tests are on their way.
Thank you. Do you have a second question, John?
Yes, I do. With the vaccine boosters rolling out, I'm curious to know if the government will be changing their official description of fully vaccinated to 3 doses, and if that affects isolation as well as how individuals access vaccine-dependent services such as restaurants and other places where you would have to present your proof of vaccination.
Yeah, that wouldn't be a call from me. That would be a call from the medical officers across Canada.
So we're getting tricky here, but it's important because people are all going to have the same question. So we now have two definitions of fully vaccinated. Sorry, folks, that's just the way it is. If you're thinking about proof of vaccination or mandatory vaccination for workplaces, fully vaccinated is 2 doses. That's a national definition, and it is what it is. If you're thinking about because you're a case or a contact and whether you need to isolate and for how long, then you need to think about, and I'm going to read this because I want to get it absolutely right. Just a second. Oh, there's a lot of pages here. Okay. For contacts or cases, fully vaccinated means you've had 2 shots and it's been between 2 weeks and 6 months since your second shot, or you've had 3 shots and it has been 2 weeks since your 3rd shot. Thanks.
Thank you. We'll now move to Haley at Yukon News.
Thank you. My first question was, as we're looking at the potential of the hospital being overwhelmed, if we do see a lot of Omicron cases, I'm wondering if you could explain how that works. If our 4 ICU beds fill up and we're sending folks down to Vancouver, and they're also, or Vancouver or British Columbia, and they're also seeing a strain on their healthcare system, how does that work for priorities?
Do you want me to speak to that? Sure. Yeah. So how it works is we do our best with what we've got, and we work teamwork across the country. So we've seen this in other places. There's been strain in parts of Alberta. We've seen it in Ontario and other places. We augment. The hospital has an acute care surge plan, and they implement that. We have access to the national supply of emergency materials and equipment, and we implement that, and we work with partners to bring healthcare providers in, and also to move people around the country in order to ensure they have the care that they need. We wouldn't be the first to be in that situation, and we all need to do everything we can to avoid it. Thanks.
Just add that whether it's in COVID days or not in COVID days, we have always received exceptional service from the two provinces that we rely on heavily, both British Columbia and Alberta. Anybody who's ever had to go out for medical or medevac, we really do have instant access to some of the best medical care in the country, if not the planet. And so nothing should change really when it comes to our relationship with these health centers.
Thank you. Haley, do you have a second question?
Thank you. I do. My second question was about mandatory self-isolation. I'm wondering, if people are not getting a positive test done, is isolation still enforceable under CIMA if you have, cold symptoms, for example, and are going outside the community and not self-isolating? Can you receive a fine for that? How does that work?
People are thinking about whether to self-isolate or not. This isn't the time to think about whether you're going to get a fine if you break isolation. This is the time to think about the people you love, the territory you love, and do the right thing and isolate. It's just not the time to think about that.
Yeah, I would just add, our approach has always been education as opposed to go right to the restrictive nature of CIMA. And if you take a look over the last 2 years, Haley, when we see what Yukoners mostly do, which is adhering to the rules, what ends up happening is we can move forward. If we see folks that aren't, and we see spread or we see outbreaks, these are the situations that then invoke more severe measures, not just here, but right across Canada and the world. So we've been very lucky in the Yukon because most Yukoners have been very kind, have been very good to keeping up to date with the most up-to-date measures. We don't want to be overly an overemphasis on enforcement. We want to really focus in on education.
Yeah, and I might add that, isolation can be hard, and we're doing all we can to support people who need to isolate. And it's going to take the whole community to support people at this time, and that's another part of what we're asking of people. Thanks.
Thank you. We'll now move to Maya at CBC.
Hi. My first question is for Dr. Elliott, and it's about long COVID. What kind of data is the government gathering on long COVID, and what can you tell us about what you found?
Yeah, long COVID or symptoms that extend beyond the acute phase or the short period in which people are infectious and ill, have that inflammatory response, is something that's occurring in Yukon and around the world. We're working to develop the systems to gather that data and watch it more closely. And as we have findings that develop, I'll be happy to share them. Thanks.
Thank you. Do you have a second question, Maya?
Yes, and this is for Premier Silver. I spoke with Yukoners who have long COVID, and they say it can be especially hard to get proper care for their symptoms in the north. They say they're being dismissed by medical professionals or have to wait years before they can see specialists to treat their symptoms. I'm wondering, what plans does the Yukon government have to help people with long COVID in months and years to come?
I would say, our healthcare system in the north here is extraordinary. We're all grappling with this virus, not only just the different variants, but long-term effects. And, we do our best with, the isolated nature of living up in the north. We do our best with small populations and massive geography. And we hold our own when it comes to conversations on a national level as far as getting the resources that we need to keep Yukoners safe and healthy. And we'll continue to do that.
Thank you. We'll now move to Tim at the Whitehorse Star.
Yes, good morning, or I guess afternoon now. My first question is for Dr. Elliott, and I'm going to echo some of what Haley Ritchie just asked you, as far as using symptoms to identify whether you should self-isolate or not. I'm not sure that what you're suggesting is really that practical. I myself have respiratory allergies, and it's rarely I have a day where I don't have sniffles. Am I supposed to self-isolate? My wife has asthma. She has a cough almost every day. Is she supposed to self-isolate? Those aren't practical symptoms to use, and you're asking a lot of people to go and self-isolate just on that basis.
Yep, I am asking a lot of people right now. And I think some people do find it hard to understand how their symptoms could be lead to a diagnosis of COVID, and that's why we're developing tools online that you can use to help you with that. Some people have chronic conditions that cause them to have symptoms that are the same symptoms as COVID-19. Let me tell you a bit about what we're seeing when we talk to people who get COVID and some of the challenges we have. It is very challenging to manage an infectious disease that causes mild symptoms in most people. It's very challenging to limit the spread, and that's why we all need to do our part. Some times, and we've had any number of these situations, which person can understand. Somebody wakes up in the morning, Monday morning, they have a sore throat, but they were out shoveling the driveway last night, and every day after they shovel the driveway, they get a sore throat. Tuesday morning, they wake up with a headache. Well, guess what? First week back to work, always get a headache on the first week back to work, carry on about their business. Day 3, fever, chills. So they say, wait a minute, I've had symptoms for 2 days already, and I've been going about my business. How many contacts am I going to have to phone and say, you know what, you're a contact, you've been exposed? So it's not always easy at the individual level to know which symptom is attributable to COVID-19 versus other things going on in one's life. And that's why we're developing tools. I would say at this point, you err on the side of staying home and away from others because there's an awful lot of COVID spreading in the community, and people can be exposed in any place. So that's what we're asking people to do right now.
Thank you. Tim, do you have a second question?
Yes, I was just wondering how many people are in ICU at the moment with COVID symptoms?
To my knowledge, in the territory, we have one person who's in ICU at the moment.
Thank you. We'll now move to Mike at Media Q. Hello, Mike at Media Q. We'll circle back to you. We'll now move to Jackie at CBC Yukon.
Hi. My first question is for both the Premier and Dr. Elliott. It's related to the COVID situation in Dawson City. So yesterday, 36 of approximately 250 students showed up for school. And I've also heard from a number of community members who say they have no faith in the Yukon government-provided case counts for communities, that the numbers are just too outdated or too behind to be relied on. There's been a clear break of trust in the community of both the government and public health recommendations just based on student numbers and what community members are saying. How will you address this? How quickly can you start reporting community numbers? What do you say to Dawsonites, and particularly the Premier, since you're their MLA as well?
Yeah, I would say that the Yukon Communicable Disease Center has done an impeccable job when it comes to testing and to making sure that we have the statistical relevance that we need when it comes to the health of all of our citizens. As a teacher in Dawson, especially with this weather, it's really hard to get a whole bunch of people to school in the best of times. I would say that the school system The educational department, the Chief Medical Officer of Health, everybody is live to the situation in all of our schools. And we will make sure that every single building that we open as a government is safe. We are aware that there was a low attendance. Again, it is minus 50 up there as well. And I wouldn't say that there's a complete lack of trust. I would say people have questions. And that has been the status quo for the last 2 years when it comes, every time we get to another outbreak, every time that we get to another fork in the road, it's always challenging times. Add on to that the exacerbating factors of the temperatures right now in Dawson. I remember being in school before COVID, and yeah, if it's cold out, you're going to have a lot less people in the school. When it comes to the accuracy of our tests, again, we have the best testing with PCR testing, with our availability in BC as well. And really, again, it comes down to if folks are using testing to allow them to go do things, that's not what testing's for. If we use testing to make sure that we have the statistical relevance to track and to trace and to understand how this virus reacts and acts, then we're doing it properly. I understand people's frustrations. I know that for every call that I get for people saying to shut down the school, I get 5 other calls saying thank you for not shutting down the schools. And it's a difficult job to make. It's difficult decisions to make. Those decisions are made easier because of the profound professional advice that we get from Yukon Communicable Disease Center and the Chief Medical Officer of Health.
Address some of the questions too, if that's all right.
Yeah.
Thanks, Premier Silver, and I know that touches pretty close to home. I'd like to talk a bit about the community numbers, the numbers of active cases by community and what those numbers mean. Let's use Dawson as an example. So as of this morning, we have 20 active cases this in Dawson City. This means that 20 people with a residence in Dawson City, according to our files, have COVID-19. They may live in Dawson City and be somewhere else. They may live in Dawson City and be out of the territory. I also want to say that we know that not everybody with symptoms is getting tested. Our test positivity rate is over 30%, and that's okay. In fact, as I said, if you have symptoms, you can assume it's COVID, and we'll get more information soon on exactly how to do that. So I think when people look at these numbers, you do have to know that it's not an exact count. What we're looking at is trends, changes over time, and also we're looking to help those people who are at risk of severe outcomes, because those are the ones who need medical and public health support, those people at risk of severe outcomes, and those who are at risk of exposing others or causing an outbreak where there's a lot of people who are at risk of severe outcomes, such as in long-term care. So I think people have to recognize what the numbers mean, and we've been really transparent about this, what they mean and what the limitations are, and certainly it takes a lot to have a number that is verified, checked, confirmed, and it takes, we're working quickly, but it still takes a bit to verify numbers. So I think that's a part of the system that everybody in the world, around the world, is working with, and it's really important to know that if your community also says there's no cases, so Beaver Creek, Burwash Landing, Carmacks, Destruction Bay, Faro, Mayo, Ross River, all of whom have no active cases according to our count. Does that mean there's no one with COVID in those communities? It doesn't mean that. It means that there's no one with a residence in that community who's been tested and tested positive and has been entered into our system, which happens really quickly. So I think really we have to be careful about knowing the strengths of these numbers. We can trust these numbers on the page, and knowing that not everybody's getting tested, not everybody is counted, and they're based on the best information we have, which is where people live. Thank you.
Thank you. Jackie, do you have a second question?
I do. this could also go to either the Premier and or the Acting Chief Medical Officer of Health. So we've seen really long lines for the drive-through testing center in Whitehorse. I've heard from a few people who say they've been turned away for capacity issues. As well, I'm hearing from people who don't drive but need or want testing who are having difficulty accessing it, because even with the other testing center, you're not supposed to take the bus if you're symptomatic. Some cab companies will not pick up symptomatic people, and walking at -40 to the testing center is unsafe and unrealistic. I'm wondering if you can confirm that there are currently capacity issues at either or both of the Whitehorse testing centers. What options exist for people who don't drive but need a COVID test? And as well, with the new recommendations around testing, how will you track cases, and how will people who need access to these COVID support programs get them if they don't have proof of their positive COVID status?
I can start.
Sure.
I'm sure you have more on this too. Yeah, I mean, it's no secret that right across Canada, testing is being strained, and that's no different here in Yukon. Again, exacerbating that is our cold temperatures as well. So we do recognize that there is a strain on the testing. I thought the information shared today by Dr. Elliott as far as how we are going to move into a new era, with COVID and with the Omicron, and how we shift our priorities. I think that was very succinct messaging today. But we do recognize that the system is strained here in Yukon. It's strained right across Canada.
Thank you. To build upon what Dr. Silver said, people might be having symptoms and having difficulty getting a test right now, and they might wonder what it is they should do. Here's what you should do. If you have strong immunity because you don't have a chronic disease, you're not elderly, and you're fully vaccinated, you should stay home for 7 days from the first symptom and take care of yourself, stay away from others, and you can go back in off your isolation. Once 7 days have passed, you don't have any symptoms, and you are off all fever-reducing medicines like Tylenol, ibuprofen. If you can't get a test and you either don't have strong immunity or you have a chronic disease, whatever age, or someone you're caring for fits in this situation, and you can't get a test, the best thing to do right now is to book your test and check in with your primary health care provider if you or the person you're caring for needs care. We have a fantastic primary health care system. We have virtual appointments available, and they can help you with how to care for yourself and what you need, and whether you need any further assessment. If you get really sick, you need to go to the emergency department. The emergency department's open. It's available. It's safe. And that's what you need to do. So even if you can't get a test, there's a lot you can do right now to take care of yourself and to take care of those people who you're caring for. Thank you.
Thank you. We'll now move to Laurie at Radio-Canada.
Oui, bonjour. Ma question est pour le docteur Elliott. Je sais que vous l'avez dit en anglais, mais je vais vous demander si vous pouvez me réexpliquer en français qu'est-ce qui a motivé votre recommandation de ne pas repousser la rentrée scolaire en janvier.
So, Dr. Elliott, could you please repeat in French what motivated you not to recommend keeping the schools closed as been done in many other provinces and territories?
Merci pour la question. Je vais parler au sujet des écoles. Les écoles au Yukon sont ouvertes à l'heure, la journée qu'il faut cette semaine parce qu'ils sont saufs, ils sont sains, ils sont des bons environnements pour l'apprentissage pour les étudiants et pour ceux qui travaillent là. Il y a beaucoup de questions au sujet du rationnel pour ça, mais il faut savoir qu'ici, on avait déjà beaucoup de de plan opérationnel dans les écoles et on a aussi une bonne relation avec le département de l'éducation du Yukon et nous avons bien parlé pendant les vacances d'hiver et aussi nous sommes toujours en contact au sujet des écoles. Il y en a des écoles qui ont fermé et inévitablement, il y en a dans l'avenir aussi, qu'il faut se fermer ou bien aller aux options virtuelles à cause des choses qui ne sont pas COVID-19 ou bien des maladies comme ça. Par exemple, s'il n'y a pas assez des travailleurs, parce qu'il y en a beaucoup qui s'isolent. Les écoles ici sont saufs, ils sont saines, ils sont des super environnements pour les étudiants, pour leur santé mentale, sociale et intellectuelle. Merci.
Thank you. I won't ask you to repeat in English, Dr. Elliott, as you did answer that question previously. Une autre question, Laurie? Laurie, do you have another question?
Oui, excusez-moi. Toujours pour la docteure Elliott, on voit par exemple en Afrique du Sud, après l'explosion des cas dus au variant Omicron, on voit qu'il y a un petit peu d'espoir quand même qui arrive. La semaine dernière, la docteure Bonnie Henry de la Colombie-Britannique a aussi dit qu'on pourrait rentrer dans une phase où finalement le virus va devenir endémique. Je me demandais, docteur Elliott, qu'est-ce que vous pensez de ça? Est-ce que vous êtes d'accord avec ça? Et surtout, qu'est-ce que ça va changer dans l'approche qu'on va prendre face à la COVID-19?
So the question is for Dr. Elliott. We've seen in South Africa that the cases disappear quite rapidly. There was also a recommendation in BC from the chief medical officer there that we can open up a bit more with Omicron. So what is your take on what is being discovered right now about Omicron, and how will it change the recommendations that you have right now?
Merci pour la question. Il y a beaucoup de monde qui veut savoir qu'est-ce qui arrive pas maintenant dans le temps court, mais à l'avenir. Ce qu'on sait maintenant, toute l'évidence scientifique, est que les vagues de l'Omicron sont les vagues qui accélèrent vitement et dès maintenant, on pense qu'ils vont aussi partir très vitement. Et ça, c'est difficile quand on est dans les endroits des autres cas, mais ça, aux longues périodes, c'est une étape à avoir le COVID-19 endémique. Alors, si le COVID est vraiment comme ça, si l'Omicron est vraiment comme ça, et que l'évidence maintenant ne change pas, moi, je pense qu'on va avoir des mesures plus strictes au temps court, mais au temps long, quand on a une population avec l'immunité forte, les boosters, les enfants, etc., on va arriver un jour, et je pense que c'est pas tellement très longtemps, à enlever les mesures et se relier aux gens, à tout le monde, de se manager et prendre soin soi-même, savoir ce qu'il faut faire avec cette maladie. Et aussi, on verra l'évolution normale des virus, c'est que ça devient moins sévère. Alors c'est ça qu'on espère, que la prochaine, c'est encore moins sévère que celui-ci. Ça, c'est ce que je pense qu'arrivons à l'avenir, mais l'avenir me surprise toujours maintenant. Merci.
And Dr. Elliott, if I could get you to repeat the summary of that answer en anglais.
Oh, sure. So a lot of people are wondering what the long term will bring for COVID-19. I'm wondering myself. So I can tell you what the science is telling us today. The science out of South Africa, it looks like the COVID Omicron wave went up quickly and it also ended quickly. Lots of differences between South Africa and Canada, so we are watching the UK and other places around the world that are experiencing this to see whether they also peak quickly and descend quickly. It makes it very hard during that peak because of this risk of hospital overwhelm. But it also makes it a short period where we need these strict measures. And my hope is that we'll be able to reduce the measures as quickly as they've come on. And we do that based on the data and the science at the time. We also know that there is a time not too far away where even more Yukoners have strong immunity. Strong immunity brought on by boosters, strong immunity brought on by pediatric vaccines. And we expect the vaccine options as well to increase. That is going to be a busy program. So with that strong immunity, it also means that with common COVID sense, we can reduce the measures that are enforceable and go about our day-to-day lives. There will always be, as in the near future, people who are more vulnerable, and those people will always need some degree of protections, and that's something that we can all do to help protect those people. This is what I foresee right now. I foresee the days getting longer, and with that, us also using our COVID sense. But I would say this journey with COVID is a lot like a wilderness trip. You never quite know what's going to come your way, and that is part of the journey. And if you let your guard down too fast, you're going to get burned. So you know, we need to keep our COVID sense about us, and that's not going to change. But the better we are at that, the more we're going to get to a more stable situation and learn to live with COVID. Thanks a lot.
Thank you. We will now move to our final reporter on the line. My apologies, I don't have your name here, but the reporter with l'Aurore Boreale. Just checking one more time. Do we have a reporter from l'Aurore Boreale on the line? All right, I'll circle back one more time to Media Q. Mike from Media Q. We understand there is a lot to cover today, so I'd like to take the opportunity to circle back with all reporters for one additional question. So if you're still on the line, I'll start with John again at CKRW. I'll move to Haley at Yukon News.
Great, thank you. One more question, I think, for Premier Silver. I was wondering, the number of rapid tests that we're expecting from the federal government, is there a reason you can't confirm that number right now? I've heard 100,000 as a rumor, and I'd just like to know if we could confirm that number that we're getting from the feds.
Yeah, that's the number I heard as well.
Thank you. We'll move to Maya at CBC.
Yeah, I think you mentioned that the positivity rate was above 30%. Can you give the exact number?
So currently, the 3-day running average positivity rate is 35%. Thanks.
Thank you. We'll move to Tim at the Whitehorse Star.
Thank you. With that 35% positivity rate, could you give me a ballpark figure on how many undetected cases that would compute to?
Yeah, I wish it was a perfect science like that. It's not. That number, 35%, means that of every 100 tests that are completed, 35 of them are positive. We use that combined with the rate of increase and direction of increase to tell us that we expect the case count to continue to increase over the next week or so. Thank you.
Thank you. We'll move to Jackie at CBC.
Hi, I just wanted to loop back to my second question. So again, for people who can't or don't drive in Whitehorse, how can they access testing? And if the advice now is that not everyone who's symptomatic needs to be tested. What does that mean for the case count and tracking cases and kind of gauging how well we're doing?
I don't have any specific answers for you right now as far as the complications of getting to a testing site in minus 40, with a strain on the medical system as well. But we can have officials follow up with you and give you some specifics about the full gamut about how we're trying our best to get testing out the door.
And in terms of what it means for case counts, when we decrease our testing rates amongst people with good immunity and mild symptoms, it means that we will continue to follow case counts and percent positivity, and those will be indicators of what to expect in the coming days, but they are not exact counts of cases. They never have been, honestly, and they will become less so. What is a good indicator is the number of people who need hospitalization, and that is because that's a very distinctive indicator, and it's also what we are working to prevent. So we will be following that as well. And all of these indicators together require clinical judgment to really look at what the situation is and what the next best step is. And so I'll continue to watch this and give my recommendations as they're needed. Thank you.
Thank you. We'll now move to Laurie at Radio-Canada.
Oui, bonjour. Ma question est toujours pour la docteure Elliott. Je voudrais revenir sur le cas des écoles et je me demandais qu'est-ce qui pourrait faire en sorte que vous preniez la décision finalement de remettre l'école à domicile et non l'école en personne. Est-ce que vous avez, je ne sais pas, un barème du nombre de cas d'élèves ou alors du nombre d'employés qui ne sont pas disponibles? Comment ça va marcher? Français et en anglais, s'il vous plaît.
So the question is for Dr. Elliott. What kind of indicators would you use to reconsider keeping schools open? Would it be the number of employees that are sick or the number of cases you would have within the school population? What would you look at to change our take of keeping schools open right now?
Okay, I'll start in English. So some people are wondering, what would it take for us to move to virtual learning, online learning, or other options? So the options that we would look at next would be reducing the number of students in schools. We've done this before by asking parents who can keep their students home to do so and move to virtual learning. And we also have a more stringent sort of characteristic of priority populations that we would do if we needed to do that. If we apologize, if we need to move entirely to virtual learning, we will do that, and the Department of Education is ready to do that. Schools may move entirely to virtual learning or classes to virtual learning because of other reasons besides COVID-19. For example, if there's not enough employees to run the school facility safely, or any number of other reasons. In terms of which measures, communicable disease measures we're watching to inform this decision, we are watching number of cases. We are watching, is there transmission in school? So when we see cases amongst school-age children, we look at where did they acquire their disease, and is the school a place where we're seeing a lot of transmission? It has not been that case. We look at the severity of disease amongst children. We look at how well is the school able to carry out the operational plans and keep kids safe and healthy. We know that if we move to virtual learning, even if we move to part-time virtual learning, as we had in the high schools earlier in the pandemic, it's very hard to shift back. And so not only is it a big decision in terms of safety and health and et cetera, it's a big operational decision as well. We will take it if we need to keep people safe. and students safe, and we're ready to do that, but we don't need to do that right now. Thanks. En français. OK, bon, en français. Il y a beaucoup de monde qui se demande quels sont les facteurs qui sont considérés dans la décision de avoir les écoles aller aux options virtuelles. Il y en a deux raisons vraiment pour aller au virtuel. Un est les raisons opérationnelles ou fonctionnelles. Ces options sont, par exemple, s'il y a pas, il y a beaucoup des employés qui sont malades, qui s'isolent à la maison, et on ne peut pas opérer les écoles. Ça, c'est une raison, et ça, c'est la décision du département de l'éducation, etc. Il y a une autre raison, et ça, c'est à cause de les écoles sont un des facteurs qui contribuent à la transmission de COVID-19, et fermer les écoles ou bien aller aux options virtuelles, c'est la meilleure option pour arrêter la transmission. Il y a des étapes dans cette décision. Les étapes d'aller avec une partie des étudiants virtuels, ou bien toute l'école devient virtuelle. Les choses que je considère dans cette décision clinicale, ce sont si on a des transmissions dans les écoles. Quand on a des cas dans l'école, on regarde est-ce qu'ils ont obtenu leur maladie à l'école. On ne voit pas ça beaucoup. Et on regarde les options qui sont plus sauf et sains pour la santé mentale, physique, émotionnelle pour les enfants. Et aussi, on regarde si on a, et on n'a pas maintenant, un variant qui est plus sévère à cause de maladies plus sévères. On fait des décisions si on peut avoir les plans opérationnels qui sont assez pour arriver. Et maintenant, je regarde tous ces indicateurs, et je travaille beaucoup avec le département de l'éducation pour que nos écoles soient saufs et saines. Merci.
Thank you. That concludes our COVID-19 update for today, the 1st of 2022. Our next COVID-19 update will be next week. Thank you again to our speakers, the media, and everyone who tuned in to watch live over Facebook. Stay safe, everyone.